My husband built grain bins. He was a welder, fabricator. He did all kinds of things at his job. He was at Davenport, Nebraska, working on a farm over there, building a big grain bin system with his crew when the accident happened.
911 emergency. What's your emergency?
We had a scout fall on a man. He is crushed right now underneath of it. 1 second.
Sir, can you tell me where? Are you still there? Sir.
I saw him sitting there, and I didn't even know if he was alive at that point. He was pale white. This big pipe was laying on him. I remember thinking to myself, I don't see how this is going to end in a good way.
He was in this little compartment kind of area, basically sitting, holding the pipe, and looked like death was setting in. Somebody said, "The leg is gone, his leg is gone." And all you could see was a piece of wood laying by his leg and blood, lots of blood.
Laverne and I were in kind of behind getting him stabilized with the tourniquet. We couldn't get to his leg where the pipe was, so we had to treat the first life threat, which was the arm. We had just had tourniquet training, which was amazing. I don't even think it was 30 days before this incident. At that point, all we could do was pack the wound the best we could. His leg was just laid completely open from the knee down.
We left the boot on the left leg with the tourniquet, and then I went to the right leg and cut the boot off. The bone hadn't broken through the skin, but it was right there.
We unload him off the back of the unit, and we're rolling into the emergency room. It's like all hands were on deck. Everybody was dressed, they had gowns, they had masks, and there was a lot of people in there. And I think at that point, that's when I realized this is even more serious than I thought it was.
I got the phone call. It was August 13th of 2018. I wasn't super panicked at the time. I wasn't, about a month before this accident, he actually cut his hand and had to have a few stitches put in it. So I wasn't thinking anything about the actual reality of what was going on. I was thinking a broken leg or something to that degree. We got to the emergency room, we got checked in, we got taken to a little room, and the chaplain comes in. When it finally hit me is when Dr. Samani came into the room to explain to me some of what he was witnessing and what he may have to do. He looked at me and he said, "I may need your permission to amputate." And that's when I knew it was serious.
We got a call from the outside hospital about a level 1 trauma. But what was so surprising was his left lower leg and left lower arm were hanging by the skin. You don't see that. That's not routine for a trauma patient to present like that.
Across his foot, he had severe injury across the midfoot, and basically a severe crush injury to the middle of the foot where he basically fractured every single bone across the middle of his foot. He also had dislocations across his midfoot and multiple fractures in his forefoot as well. He had over 30 fractures present in his foot. With this type of injury, the rate of limb loss on that extremity is probably greater than 85%. So the goal really is to save that functionality so he can walk again. It's really, really hard to walk with one amputation. It's nearly impossible with it on both sides.
The first time that I got to see him, the chaplain asked Dr. Samani right before he left if it was okay if I see him before they take him to surgery. And when he came out, he was just laying on a bed covered up. He looked like he was sleeping. I didn't see any of the injuries. I didn't, get to talk to him. He was unconscious. I gave him a kiss on the forehead, and off to surgery he went to unknown. I didn't know if I was going to get to talk to him again. I didn't know what was wrong. I didn't know the extent of the injuries at that point.
It's always very interesting going to talk to family members after a sick trauma patient gets here. When I saw her, I looked in her eyes. I could see fear. My first words to her was, "It's gonna be okay." I told her it was gonna be a long road, but God was in control. She was a woman of faith, and that sealed it for her. That was the first chapter of the book, to recovery. I told her it wasn't going to be easy, but we're standing with her and her husband every step of the way. And after that, she was a big source of strength to her husband.
The very first time that he opened his eyes, the nurses were telling me, just talk to him. Just, let him know you're there. I had just told him, I said, "Hey, Jimmy," I said, "your dad's here." And he just opened his eyes. This was the very next day after being admitted to the ICU. And he was just normal, happy Jim. He just kind of opened his eyes and looked at his dad and he waved. That was the first time he realized that his hand was missing. He had a panic attack because this was completely different than when he went to sleep. And that was very hard for us to see him in pain. The next time that I got to see him awake was the next day, and it was so much better experience.
One of my first coherent memories of after I woke up was trying to ask my wife what all happened to me.
He kept trying to get me to explain what happened, and at the time I didn't know that. And I went, because he kept pointing at his arm, going, I go, "Yeah, you lost your hand." And I said, "It's okay." I said, "You don't need that hand. You didn't use it anyway."
I tell my trauma patients, 95% of recovery depends on the patient. This patient was amazing. When he could move his right upper extremity, the first thing he did was to give us thumbs up. I mean, you walk into a room and the patient you had stayed up for hours to save his life gives you thumbs up. That's a feeling you can't describe.
Since that moment that he woke up, he has been very positive through all of this, which has just amazed me.
So usually after a traumatic amputation like what he had, it's pretty rough. But Jim was actually like, "Yep, this is what happened to me. I'm gonna make the best of it. I've got my right arm and I can do a lot of things with my right arm. Just show me what you want me to do and I'm more than willing to try."
A couple days after he was on the ICU, he got up, sat on the side of the bed, and then was like, "I think I'd like to go to the recliner chair. Can I do that?" And that was really the point where we're like, okay, yeah, he's gonna get out of here.
Yeah, the day that Dr. Hughes told me he was going to try and stimulate more growth by putting me into a walking boot and going to let me start walking, I was ecstatic.
We're going to get that right foot a little wider.
The beauty of our trauma team is that we all have one mind, we have one goal, we have one mission. It takes a team to have the kind of success that we have. And that's what drives our trauma center.
You're doing great.
We've come so far in such a short period of time. And you start thinking about the sheer number of people involved in our story is overwhelming.
Jim wouldn't be where he is today without all of the care people, the nurses, the doctors, the EMTs, everybody in between. I mean, if we didn't have the people in place that he had, that God put in our path to save him that day, he wouldn't be here.